last March,
I'm going to
House
record
Bill
this.
1929 was passed that again established the funding and the mandate from the legislature to establish two houses, one on each side of the state, for up to 90 days for young people who are being discharged from an inpatient behavioral health facility. Some of what we learned when we wrote that report that initiated this program, some young people said I could have gone home to my family, but they wanted me to be on my meds for 30 days or substance free for X number of days. So we don't think all the young people that come to this program will need to be there the entire 90 days. But we do think that not sending them back to the streets for 1 hour is going to make a world of difference. And parenthetically, I thank the managed care organizations for their support through this process. But as you know, Healthcare Authority released a request for proposal some months ago before the holidays. And the bill does call for an east side and a west side. We're still working on the west side provider, which we'll have some conversation about later. But I just have the distinct honor of sharing with you and then welcoming to talk and say a few words and answer any questions. Ryan from Excelsior in Spokane has been awarded the East Side contract, and they're still in negotiations, I understand, but we're just so excited, Ryan, for the work you do over there and not just by that area, because we know you serve young people from all around the state. Sarah and I had the opportunity to go visit and do a site visit during the summer. Sarah's from Spokane, so she's part of that local choir with these good folks. Ryan, please, we welcome you and thank you, and just really excited to hear from you and your thoughts about bringing this program alive.
Yeah, I'm excited to be here, and thank you for the opportunity and the hard work getting us to this point. I also have two colleagues, Stacy Heron and Lauren Zunker, on the call. Feel free to chime in, but I've been nominated to be the speaker, so you got me. Well, first I want to again say thank you so much for the work you all do in advocating for this population. We've been working with transition age youth for 40 years, and we have so many stories early on in Excelsior's history of kids getting to that 18 marker, that artificial 18 years old, and really leaving them to the streets. And so we were a first mover when extended foster care was extended and saw the value in that. And then I had this experience where I was at Eastern State Hospice about 10 years ago, and I'm sitting with a young person, and the discharge planner was saying, we need to get this youth a house, or a place to live, and a job in 2 weeks. Well, a couple weeks prior, they were admitted to Eastern following meth-induced psychosis. That same day, I was out at the university where I went to college, and I'm walking around and I'm going, oh my word. I mean, it took me 4 years to sort of become an adult, and I relied on my parents and my community, which I'm very privileged and have a rich environment there. It took me that long and then some to fully adult. And here we were as an 18-year-old to try to get someone in 2 weeks. So at that time we built we pitched a program to the RSN BHO at the time, and built our program that had some of those same core characteristics of what we do for other young people. Is if you make it a little bit easier for them to be healthy, they can get about the business of becoming an adult. If they have a place to live, if they have some support navigating systems, give them a lot of choice, they'll be successful. And we've been running that program ever since for 17 to 21 years old. So when this RFP came up, it's fits perfectly in our continuum at Excelsior to serve this population in a developmentally appropriate way, so that they can focus on, when they're an inpatient, focus on their mental health and sobriety work, or their substance use work, and then get on to the next phase with a little bit more support, a little bit more time, and get them connected to the next phase. And it works really well in the rest of society. It works really well with the folks that we serve if it's built and you just help them along. So we're excited to do that. A little bit about Excelsior. I said we've been around for about 40 years. And we have this gem of a piece of property here in Spokane. It's about 32 acres, and that's where it's going to be. On that 32 acres, there's a basketball gym, there's recreation facilities. We just opened up our new primary care facility, so the young people have walking access to that. If they choose that as their healthcare provider, they can get their medication management needs. We anticipate a lot of them will, just because of ease of access. We'll keep spots open for them, and we'll try to do next day service, things like that, so they can really, again, focus on their next step, and we can remove some of the access barriers to mental health and primary care and medication management, so that there's no disruptions in that. So we're really excited about that component. We've got about 160, 170 staff at any given time, and that's in a variety of services, wraparound intensive services, primary care, like I mentioned. And we're opening up some really innovative housing models. That's what we're hoping to build more on our 32 acres. In June, we'll break ground on our intergenerational living environment. So it's a 24 unit apartment. 12 of them will be focused on seniors, and 12 of them will be focused on this population. So kids exiting institutional care, but mostly we really want to focus on foster care as our kind of taproot, because we've seen what happens when kids don't have a secure place to live, but more importantly, when they don't have a community that's informally orbiting around them and looking out for them. That's a really lonely place to be, and there's no place to fall back on. So that campus sits right next to our vocational center with, a garage, and you can go tinker and, learn all that sort of stuff if you want. But it really is, the intention is to build community in informal ways for young people to build that if they want to. As far as the program goes, we will be working on making the living environment. It has kind of a dorm feel, so we need to lean into that and make it more dorm-like. But it's on a great area. Like I said, there's basketball, there's all these other amenities into the environment that we're excited for the young people to access. And it's connected to a pretty robust continuum of care. I can keep talking as long as it's important. I can also stop and take questions.
Well, let me start off.
Yeah.
And again, these are all things we'll talk about. People should know that there's also part of this legislation. There is money for a TA and consultant, of which North Star bid on and won that. So we'll be supporting Ryan and his team. One of the things when and Sarah took the lead on this, ran focus groups around the state with young people, and the young people here also co-facilitated many of those. But love to hear you talk about just how you envision. And again, this is just brainstorming. This is not like the contract's going to write. But one of the things that we heard loud and clear from young people is, on the one hand, we want an environment that's not institutional. We want a home-like environment that respects us as being 23-year-olds, 20-year-olds. But we also want an environment that supports and strengthens and values me trying to be substance-free and or take my meds. And so one of the things that came up, and I think you know this, we talked to you about this, I believe, that there were some people that said, well, it should be 100% harm reduction, and even if Jim is banging dope nonstop, he should stay there. And what we heard from young people was, well, if Jim relapses but wants to get back on track, then we want him to be in this community. But if Jim has decided, I'm not up for that substance-free stuff, then maybe Jim should be helped to find another place in order to protect that milieu. Assuming I articulated that
Yeah.
and you're kind of
Yeah.
clear on what I'm talking about, I'd love to just hear you share your thoughts with the group.
Yeah, we certainly have harm reduction programs, and they work well and they really fit when they fit. And then there's also a time, I think, to sort of make for environments for people to do what they're trying to do in a pretty short amount of time, which is 3 months. And so if you throw in the complication of you know, in a living environment where people aren't maybe pursuing the same goals, that can be challenging for people. So it's less of for us, it's not a binary. You either go sort of harm reduction or this, but this is just fits a great supportive environment for the people who want that. We have other environments, you know, within our continuum that can support a different pathway, and I know there's, you know, stuff in the community that can be that as well. But I do think it's a important component to listen to the feedback of youth saying, this is an environment that's missing, which is, you know, we're going to have a more strict recovery model, and we're going to try to protect that community a bit from those outside influence that can be really distracting for folks that are, you know, trying to get a job and a house or go to school or whatever their next pathway, or really build trust back with where they're trying to go. If they're trying to go to their aunts or their neighbor that they know, they're going to want to, some of them have an expectation that, you know, they could be 3 months in a, you know, stay out of trouble and stay on some pathway, and we want to support them in that. And I think this is an opportunity to do that. I don't know if that answered how we approach that, but
Yeah, no, awesome. Again, I think young people, it was the brilliance of that too. They were saying that, you know, that whatever recovery means something different. And I'm not saying I'll never drink a beer or smoke a joint, but I want some period of time. I'm just struck by the story of the one young man who told me he thinks he'd been high since he was 2 or 3 years old. And that's because his parents were meth users, and he would carry the joint from one person in the living room to the other. So he figured he had a contact high since that age. And that when he was in this inpatient facility, these are his words. The colors look more bright. The food tastes different. Like he was almost high on this new feeling, and just wanted a chance to explore that a bit more, and was one of the ones discharged to the shelter. MJ, please.
Yeah, I have two questions. So you say a strict recovery model. What does that specifically include?
well, part of the, as I understand the intention of the youth who advocate for this program is to maintain a substance-free environment. And so we have to work out the details of, you know, how do we actually implement that, and what are the, you know, how does the community form around those principles? And that's where we really have to lean into, you know, the technical assistance and also the voices. So I don't know if the strict recovery model probably was not the maybe best way to say that, but a recovery model that is less harm reduction based and more, you know, and has some parameters around healthy behaviors related to substance use. And so that's a component of the program.
MJ, we'll get to your
Okay.
second question next. I also want to, again, thank you, Ryan, for taking these questions. None of this is
Oh,
in
yeah.
stone. It's just kind of adding to the flavor, especially since we're going to try and get two more. But Sarah, you were part of these focus groups. Anything you want to say at this point?
Yeah, I was going to jump in and just say, I also, and Ryan, you didn't mention it, but one of the things I appreciate about you all being the first is your expertise in the 3.5 residential inpatient. You all used
Mhm.
to run inpatient, so you know what works. You also know the things that don't work. And that transition into more of that transitional living type of model is really appreciated, and the housing approach. So I feel confident, like through the TA and conversations we've all had, that balance, right, is understanding how to support people coming out of that type of environment, that while you don't run anymore, you have experience, but then also helping them find their own North Star, as Jim would say. You know, and in all the focus groups, I had the pleasure of running and being with cohorts who some are on this call and some are not. There really was an emphasis on maintaining some sort of substance and drug-free environment, particularly from coming from such a strict inpatient So I'm excited to see again how we implement that and what that looks like in terms of relapsing, non-relapsing. But that was probably, it was like, I think 90%, Jim, if I'm correct, the data, or at least over 80, maybe 87. Don't quote me because I don't have the data in front of me, but that was one of the top priorities of young people, is having a safe, healthy environment where they can continue to learn what they did in inpatient and actually put it into practice in a less, less institutionalized facility.
Yeah, I think it emerged out of like an early community norm or desire out of the community, as opposed to an agency saying this is the evidence base or the moral or philosophical way it's going to be. It's more, hey, this environment would support people who, choose to live there and want to be there for, 90 days to get on with their life. And these are the parameters we appreciate. And Excelsior's, there to support that.
Yeah, it's
I
great.
promise, MJ, I'll come right back to you. But since we're here, Ryan, whatever you want to say about this question, Sarah, Johnny Ota, and others. So talk about also the need for medically assisted treatment.
We're gonna go there.
Like some of these young people are going to need some support with Suboxone or methadone, and so we are making room for that. Anything you want to say, Ryan, or I'm happy for you to
Yeah, well,
please.
like I said, like right down the walkway, I don't know, it's 100 feet, we have our family medicine clinic who, and at times has supported that MAT, but we also have community providers. So we again, we've done this about, for 10 years with this population. That's something we've supported folks on in this age group for a long time. So I think that's an important component of treatment. And we have the medical providers to monitor it, and then also the referral patterns, pathways to connect folks to.
And before Johnny rides off on his bike, you've been a leader in this space in King County for a long, long time, pal. Anything you want to say at this point? Put you on the spot?
Oh yeah, no problem. Thank you very much. Appreciate it. And Ryan, I've been out there a long time ago. Would love to come visit sometime. Appreciate that this is actually happening. And obviously all of us know about the current state of things over the last 3, 4, 5 years, the fentanyl epidemic and everything else. So we do know what the young people that will be coming to these places, for the most part, are presenting. It's like, sure, there'll be some young people that come up with stuff we're like, wow, that's new or different, or we got to work with that. But a lot of stuff we know. One of the biggest things that, and again, thank you very much for taking on this endeavor. Really appreciate that. From the beginning, as Jim has been beaten on this for a long time, and he talked to me a lot about coming out of inpatient. And what we do know is that when people are coming out of inpatient, they're coming out of very different types of facilities, right? So if you are in a psychiatric inpatient facility, which I think when you guys have had, or I don't know if you still have, but you understand that very well. And then if you're coming out of a substance use treatment center, the things that are happening in that inpatient setting and the things that will be important for you to follow through with when you get out are different, right? From the mental health perspective, co-occurring, obviously it's going to be a lot of that. And so that part, obviously, I think you guys know and understand, and I think a lot of us know and understand it. But then when you have a house full of these young people, we all know that they're going to be coming from different places with bringing in different things. And to be honest, in some ways, somebody going to a substance use treatment center and really latching on to recovery is kind of a clearer path at times, right, than some of the other ones. So I know that you all have a lot of experience in this. I'm just super interested moving forward in how to sort of join these things together. We call it co-occurring, we call it lots of things. And also when it does come to the West Side too, and I'm really interested in coming and visiting and supporting and talking to you all, but extremely important and just understanding what coming out of inpatient means, you know.
Yeah, I appreciate that. Yeah, as we learn from some of those, first people that we serve, and then drawn upon some of our experience with those same kind of referral patterns and different, people profiles, um, we'll certainly share that along.
Yeah,
Sarah, did you want to say something?
yeah, I wanted to jump into, and Johnny, thank you for that, and Ryan, and I think that's part of what will be interesting also for the role of the coalition, right? Like, and obviously Excelsior and whoever the West Side is looking at what are those data points, what are the trends, really kind of getting into some of these early predictors and the uniqueness of that population, particularly Johnny too, when you're talking about like coming out of the psych unit versus coming out of maybe just a 3.5 residential substance use treatment, and how do we effectively bridge both of those in a more less restrictive transitional housing type model. But again, I think this is where it's like my bias coming through. I'm excited it's Excelsior because you all have experience with each one of those components. And so then being able to kind of bring those together will be interesting. And I look forward to seeing how it turns out.
Before I go to MJ, acronym, can you tell the group briefly 3.5?
Sorry, when I say, so it's a residential treatment facility, and 3.5 is primary substance use, also co-occurring residential inpatient. So that's that 24 hours, 7 days a week, residential inpatient care.
Thank you. MJ, thank you for your patience.
Oh, it's okay. I got a few things. So one of them is to jump off of Johnny Otis, statement there. All these people are coming from different inpatients. How will we be able to implement what they have learned at those facilities into transitioning back into community as they do come from different places? So how can we really foster that, the stuff they just got taught and they're learning about, and how they can implement it as they return back to the community?
Yeah, great question. I think it's going to be really important that our care workers, our case managers, maybe some people call them healthcare workers, are connecting them to, their program providers in our network or in other networks, and making sure that that's done quickly to sort of sustain what they're learning on, and then also building opportunities in their living environment for them to participate in. So I'm excited we have our vocational mentorship place, to get them engaged in activities and lots of different stuff to keep people busy, and then also focusing on their recovery efforts, whether they're co-occurring or coming out of another institutional care setting. I think in our experience, a lot of the times these breaks in institutional care are real big disruptions in the quality of, counseling service, but also just medication management. It's like they don't have we've taken 90 days to get them stabilized on medication. It's working, and then they go, and then the pharmacy doesn't have them or something like that, and then they're off medications for 2 weeks, and here we go, right? So I think those components are really important to get right out of the gate. And that's why I'm excited to have a walkable medical clinic if that's what they choose, and then nursing available and things like that, because it's oftentimes just a really big cliff leaving an institutional setting for folks. I don't know if that answered your question.
Yeah, a bit. I'm just trying to figure out like how, to sustain that long-term, learning that they had, and the peer workers that you were mentioning, focusing on efforts of recovery is really, really good. The other question that I had was,
The
you said
last
there's
one.
about Okay, that there was about 160 to 170 staff workers. What is the ratio of staff to residents?
So that the 160 is throughout all of our programs, and I don't know the particular ratio that we'll have within this within here. I think there's a balance between having too many staff, and then it kind of fosters a milieu where, you know, even the word milieu, it's too formalized. But then we want enough so that there's transportation if that's needed, if we want programming options where you're going to do things and stuff like that. So we'll figure that out. There's no obligations that I'm aware of. It's really about developing the standard of care that fits for the population, and we'll kind of know more. I think our
We're
light point
excited that,
program's like
oh, please.
1 to 8, but that's like a minimum. And we've been the standard of care developer of that. And so it's changed as needs change.
Well, for the group, the legislation, and we really talked to a lot of young people and providers. So, and I don't know how the budget looks coming from HCA in your contract, but the way it is in the legislature is there was $1 million to operate the house for a year, 24/7. And the bill is silent on how many staff have to be there, but it does say include peers. And that's not necessarily a certified peer. It can be however way that evolves. And then there's 200K for behavioral health support, so that could be on site in the community. And then there's 50K for flexible funding, which that was really important to us, so that if Jim is there for 20 days and then grandma says, yeah, you can come live with me, but we haven't really seen each other for 6 months or a year, maybe you take some of that 50K and Jim goes visits grandma for a weekend, comes back, and we sort of talk about what was that like and how so we've really worked hard to try and set this up for success. And then, as I said, there's money in the budget, which we won the bid. It was open bid, open RFP process, that North Star will provide training and technical assistance to Excelsior and the providers. And we want to have that be a respectful dance because we know you're expert already. And so, how do we bring value add with young people and other voices? Um, so, and then the other thing we're looking at, Johnny's a good example of, I think, someone who we might want to pull in, other examples. But also, I've been talking to some attorney firms about some of these young people might need to quash warrants or have other legal issues that while they're in this 90-day place, how do we solve that problem for them? So, we're really trying to make this not just a chalkboard exercise, but really something meaningful. And so we will be hosting other meetings, and this is a good time in future meetings to give inputs on, have you thought of this? Have you thought of that? So as we wind this up, Ryan, I don't know if any of your colleagues want to say, if you want to invite them, if they have something that they're burning to say, or.
Can't tell if I'm on here, but hi, I'm Stacy.
Hi.
And can you hear me okay? Great.
Yep.
I am a partner with Ryan with Excelsior, and Lauren is here too. A couple of thoughts is just first off, really appreciate this partnership, and I'm looking forward to it. I've learned a ton already just in this meeting alone. And I think this is a huge opportunity for us to bridge the gap a bit and make sure that we have used this as a really sensing session as we develop, and knowing that you'll really partner with us to hear the voice and help uphold some of what we're learning within this program is going to be super exciting. And then for us, just continuing to develop really that continuum of care of thinking about all of these different populations that need the support. What's the right program for this particular juncture, and how does that fit in with, as Ryan has mentioned, the longer term plans, whether it's within our LifePoint system to the apartments that we're building and all those different pieces. And then we have some other pop-up clinics as well. I think it's just a really good place to be, and I'm excited to see the outcomes as we start this new adventure.
Great. Lauren, anything you want to add?
Yeah, I just echo my team. We're really excited to explore this opportunity. I I'm the TAE administrator, VP of operations, so I'll be helping with this program. And so we're really excited to meet people where they're at. We really focus on the individuals and building community. And so looking forward to working with this team and moving it forward.
That's great. And Ryan, before you make whatever closing remarks, the other thing I have to say is real important is not all of these young people will need the whole 90 days. And in fact, to be honest, there's a young person who's inpatient hoping there's a bed at Excelsior or the West Side. So we have to have the balance again between some churn, like getting young people to their next best place, not fast tracking that we want to launch them with a good return to community plan. But if everybody stays the full 90 days, you quickly see how that gets bogged up, and then we're not keeping young people who are inpatient. But we also think we'll know more as we get the first two stood up, what the data says we need, whether we need more of these. And as you know, we've got a request in the current legislature for two more. So anyway, I just want to say that's another creative challenge that the program will be facing. But I'm really thrilled. Ryan, how about some closing comments? And again, thank you very much for you and your team being here today.
Closing comments. Let's go. No.
All right.
Yeah.
Good.
Excited to continue the work. Last thing, I was going through some board meeting randomly from like the 1980s, and I ran across a board resolution to buy housing for transition age youth. So, there's nothing new under the sun. It's like it's some of the same core components. People need community, they need places to live, they need people looking out for them, encouraging them, opening up doors and letting people walk through them. It's kind of the same, but different names and different time periods. So excited to continue on in our work and mission, and excited to work alongside you folks. So thank you.
Yeah, no, guilty as charged. I never said I invented anything. Just
Yeah.
how do we make it happen?
Yep.
Yeah.
No, it's new in a sense, and it's also has a a deep historical root with us, and so we're
Great.
excited to